Hi, everyone. I'm Victoria Field, co-organizer of Metabolic Health Summit, and we are thrilled to be coming back to Santa Barbara, California, May 5th through May 8th, and bringing some incredible speakers out to the area to present the latest research on metabolic health and ketogenic metabolic therapy. And I have a really special guest today that I'm very excited to introduce to you. He's a speaker at MHS this year, but if you came to Metabolic Health Summit 2022, you probably remember his talk on some of the obstacles in studying ketogenic therapy in cancer. His name is Dr. Jethro Hu, and he's a neuro-oncologist and brain cancer researcher at Cedars-Sinai, and he's involved in an ongoing clinical research involving ketogenic metabolic therapy and using it alongside standard of care in patients in glioblastoma. And I'm so thrilled to introduce you to the incredible Dr. Jethro Hu. Thank you so much for jumping on with me today.
Hello, and thank you so much for having me. It's a pleasure and privilege.
Yeah, we're thrilled to have you back again. You had such a great, well-received talk at our last event, which is hard to believe it's been 2 years since then. I can't believe we've not seen each other in person since that time.
It's crazy.
Yeah, lots has happened since then for sure. But we're thrilled to have you back again, speaking to a lot of the research that you've been doing and exploring using ketogenic metabolic therapy with brain cancer specifically, alongside another one of our speakers, LJ, who is a dietitian you work very closely with. But for those who are jumping in and are not familiar with your work, let's kind of take it back to the beginning and talk about your background, number one, and then how you started to get interested in using this as a potential therapy for something like glioblastoma.
Sure. So, I've been a neuro-oncologist at Cedars-Sinai. Basically, it's been where I've been for my entire career since 2009. And certainly, even back when I started, and for years before I started, you would hear little bits here and there from patients about, what is there anything about this ketogenic diet that I've heard of? And really, in the neuro-oncology community, as far as the scientists and physicians, it was something that was recognized as being interesting to patients, but not something that there had really been too much research that was being done. And the disease that we treat, a lot of them are really, really challenging. So, for example, the diagnosis that we see the most is glioblastoma, which is an incredibly aggressive form of cancer. The treatments that we have, radiation and chemotherapy, they can only do so much. And while there have been improvements over the past couple of decades, honestly, the improvements have been relatively marginal. For most patients with the disease, it's still, just a matter of a few years at best, basically from diagnosis until they die from the disease. It's again, an incredibly difficult diagnosis for patients and families to cope with. So, with such a challenge, of a diagnosis, I would say that diet and nutrition for me initially wasn't so much my focus. But again, over the years, we just kept having patients come up to us and ask us about whether or not there's any validity to the idea that a ketogenic diet might be helpful for patients dealing with cancer, and particularly brain cancer. And then one day we had a patient who you know well, of course, Victoria, who basically asked the same question. And the difference this time was that Cedars had recently hired LJ Amaral, who you mentioned in your introduction as well, an oncology dietitian who I've had the privilege of working with. And rather than kind of brush that patient aside, she said, well, yeah, sure, let me look into it. Let's see what we can do and put together. And really from there, we started to put together a program for patients who were interested potentially in adopting or implementing a ketogenic diet. And again, at first, me being sort of a neuro-oncologist who has seen patients with glioblastoma and other just very challenging brain tumor diagnoses for year after year and seeing just very difficult outcomes, I was very skeptical that something that's just a diet would have any sort of impact in terms of a patient's survival, or not even just survival, but just quality of life or level of function as well. I thought that the likelihood that we would see anything was pretty low. But very shortly after we started putting patients on a ketogenic diet, we really started to see some pretty dramatic findings. So we had patients who certainly felt better as far as their energy levels. We had patients whose cognitive abilities actually improved. One patient who had lost the ability to read because of the tumor, who after adopting a ketogenic diet actually very quickly regained the ability to read. And, these are things that are not so easy to fake necessarily. So when I saw something like that, I really started to perk my ears up and get interested in this.
Yeah. Is this something even that you would see, not to interrupt real quick, but would you even see something like that traditionally with, your normal routine with standard of care?
No, not really. So, typically with standard of care, chemotherapy and radiation, generally speaking, what we're hoping for is just to keep the disease stable. If patients stay about where they are, that's as good of an outcome as we would generally hope for. And even then, it's a temporary outcome at that. So to see patients actually improve, and then what we actually saw was MRI scans actually show improvement. That was really something that you don't see too commonly. Now, I always think that it's important to be a good scientist about these sorts of things and make sure that we're not jumping to conclusions as far as what is helping out patients, whether or not it's the diet just by itself or diet in combination with other things. Right. But all things considered, again, it was a really encouraging preliminary experience with it. And so what we went from that experience, basically, we said, this is really, really interesting. We want to study this more formally. We want to really investigate what the effects are. And if there's a benefit, we need to be able to show this in a rigorous fashion that other people in the field are going to be able to look at and say, hey, you did the right sort of trial. You designed it in a rigorous way that's going to be able to detect the effects of the diet. We agree with the results of this study. And so the first prong of that approach is to do an early phase clinical trial or a phase 1 clinical trial, which we completed not too long ago, really with the goal of just demonstrating with great rigor that the ketogenic diet is something that can be safely implemented by patients with brain tumors. And we certainly found that it was. I will say, interestingly, there have been some other small trials for patients with brain tumors adopting a ketogenic diet. And some of those trials have not shown that it's been so easy for patients. So I'm not exactly sure whether it's something specific about the patient population that we've been working with, or whether or not, again, I would say all credit to LJ for the way that she manages patients. But for some reason, our patients have implemented it and adopted to it and taken to it quite well overall. So really pleased with the phase 1 trial experience. The results, again, are really quite promising. But ultimately, what we need to do is a larger phase trial that really is specifically designed to evaluate how effective this diet, in combination with other treatment, the standard treatment that a patient would get as far as chemotherapy and radiation therapy, how effective this combination is.
Absolutely. I think the way you're approaching it and the work you're doing, it's so critically important to hopefully, if things turn out to be positive and you continue to have positive effects, that this could maybe be implemented, but it can only be implemented after the appropriate research is done first. So I think that, we are thankful for what you're doing at Cedars-Sinai right now with patients. And I can only imagine how challenging it is to, I know firsthand from my previous work, how difficult it can be to implement this metabolic therapy, but especially when you layer on top of that a glioblastoma diagnosis and then immediately thinking about shifting your entire lifestyle, it certainly has to come with its challenges. So, what would you say? I know you've kind of touched on this at our previous conference, but what are some of the biggest obstacles you've faced? And how are you kind of looking at the future with using this as a metabolic therapy? And what do we have to overcome to be able to do that?
Yeah, no, that's a great question. And definitely it is a lot to ask a patient who oftentimes was healthy, living their lives, and then all of a sudden, plop, you've got a brain tumor. It's this horrific diagnosis called a glioblastoma. And in addition to trying to learn about that and learn about chemotherapy and radiation therapy and start chemotherapy and start radiation therapy, to then also say, oh, well, there's also this diet that in many cases is a real big change from the type of diet that they've grown up with. And to basically talk to patients about that and to implement all of those changes while they're still just coming to grips with, I mean, how different their life is than what they were expecting. It's a lot. It's a lot to ask for a patient. Now, what I will say is our patients are amazing. And of course, I don't think it's just unique to the patients that I see at Cedars-Sinai. I think in general, brain tumor patients are an amazing group of people, the patients and the families, and they are so motivated. When they find out about glioblastoma, they are so motivated to do anything that they can that is under their control that might basically potentially affect the disease. And so, of course, a lot of what we deal with is on the clinical side of things is answering all the questions that patients have. And they ask about every supplement that you've ever heard of under the sun. They ask about treatments, being offered all over the country, all over the world. Oh, I hear there's a clinic in Tijuana. Oh, I know that there's this option being offered in Germany. All these sorts of things patients want to know about because, of course, when you read about glioblastoma and it says what it says, you're going to gravitate towards anybody who has a different message that kind of gives you some sort of hope. So to be able to, talk to patients in a way that basically allows them to have, a positive outlook for the future, but is also reflective of the reality of the situation. I mean, certainly that's one of the I would say, the major challenges and my major responsibilities as a neuro-oncologist is being able to convey all of that. And, when it comes to implementing a ketogenic diet, again, if you're feeling nauseous from the chemotherapy or feeling fatigued from the radiation therapy, it's not always the easiest thing. Although, again, ultimately what we found is that patients actually take to it quite readily. I do just want to quickly just jump back a little bit to, one of the things that you had mentioned, which is, we're really encouraged. The findings that we've seen so far, preliminary, are quite positive. But I think really what we need is we need to know. We need to ultimately know as a community, regardless of what we think might work, we need to know what actually works. And the only way to do that is with well-designed clinical trials. And again, I am very hopeful. I really do think that there is something powerful about diet, something powerful about, that what you take into your body really can affect a lot of outcomes when it comes to cancer. But ultimately, if our first trial doesn't show an effect, that's still an important result because that's still something that matters to patients. It matters to patients if we say, hey, well, we tried this study, and at least when we implemented a diet this specific way, it didn't have the benefits that we were hoping that it would see. Either way, whether it's positive, whether it's negative, I think it's really just important for us to do the study so that we can know and just advise patients accordingly.
I couldn't agree more. And you have such a challenging job balancing all of this, that being an incredible neuro-oncologist and explaining all of these treatment options and monitoring the patient, but then also doing this great work and pushing this research forward that has to happen in order for us to include nutrition as part of the conversation, potentially, right? Positive or negative, we're going to learn something good out of this. And in this learning process, from where you were previously to maybe not even hearing about the ketogenic diet as being an option to where you are now when it comes to like your personal thoughts around nutrition and it may be mattering. I mean, how has that shifted for you personally in thinking about food as something potentially that might help, standard of care?
Well, I would say that my initial views were just born out of complete naivete. Like in medical school, you get no training on nutrition. It's quite laughable, actually, when you think about it. It's like nutrition is so important. Just think of all the chronic diseases that are nutrition related that we deal with and all the after effects of nutrition.
Right.
And we had zero training when it came to proper nutrition. And of course, a lot of nutrition guidance has changed over the years as well.
Oh, yeah.
I do think things are changing. So I would say from a personal perspective, again, being poked and prodded along by patients and people who are more enlightened than me to basically start paying attention to things. I am certainly at a point now where I think that diet is just a very powerful lever by which we can affect physiology. I don't know that diet by itself for a diagnosis of something like glioblastoma is likely to make a tumor disappear. In fact, I think that that's highly unlikely, but that's not what we're expecting from drugs or chemotherapy or anything like that either.
Right.
If diet is able to do something as simple as basically make the tumor react in a different and predictable way that then allows the tumor to respond well to other treatments that are targeting the way the tumor is reacting, even if it's doing something like that, that's incredibly potentially powerful as well. So yeah, I would say that I've come basically, the full spectrum as far as my thoughts as far as the importance of diet and nutrition. There are of course many other cancer types outside of brain tumors where diet and nutrition play a very central role, even in the origins of the cancers themselves. And
Right.
those aren't so much the diagnoses that I treat primarily, but yeah, I do think that there's been a lot of growth and change in the field. Again, even in our own little bubble of patients that we see at Cedars, it's gone from a ketogenic diet being something that really wasn't discussed much to now, of course, you've got supermarkets with aisles full of ketogenic diet friendly foods. Not that everything in the aisle is truly ketogenic or, that the popular diets are necessarily really, the advice that you want to follow. But I think just the general awareness that what you put in your body can really influence health outcomes, I think has improved a lot in society overall.
Yeah, absolutely. I mean, when we first connected, years ago now,
Yeah.
to see where things have come, within the mainstream has been a dramatic shift. So we're definitely making strides, I think, in the right direction. It's so great to hear, though, from your medical perspective of where we're going, where we're headed, what we need to do to get there, which, as you've said a few times, is research is so critical. And that's why we're doing what we're doing in showcasing the important work that you've got going on at Cedars-Sinai there. So, one question for you around the potential of this, as you said, you've seen some improvements overall, when it comes to actually monitoring the tumor itself and things along those lines. But one thing I want to talk about is quality of life. Facing a glioblastoma diagnosis is a pretty grim. And with that, though, there's some sort of piece to nutrition that can potentially improve and empower patients, like they're a part of it. You kind of briefly touched on that already, but you see patients, on a weekly basis where you probably see I would assume some sort of shift when they feel like they can kind of be a part of the plan and action. If you want to share what you've seen in that regard.
Yes, I mean, I think it's so important that, the treatments, once you have a diagnosis of something like glioblastoma, that it's not just that treatments are being imposed on you,
Right.
but that you understand basically the rationale of whatever it is that's being recommended. And that you're also given the opportunity to really participate and own your care. I think that's hugely important. There's a quote that I like that, I often think about. It's a quote by the playwright Václav Havel, and I'm going to butcher it, even though I think about it a lot. But basically the quote goes something like, hope is not the belief that everything will turn out well, but the understanding that regardless of how things turn out, things make sense in some way. And when it comes to a diagnosis like glioblastoma, again, it's incredibly challenging. But on the other hand, I think there are always things that you can hope for. There are always, even understanding the reality of the disease. This isn't a diagnosis that, as far as we know, despite the thousands of treatments that people have tried, is incurable. It's incurable at the moment. But despite that, there are things that we can hope for. There are things that we can aim for. We can hope to live longer. We can hope to live well. So many things that even as the disease progresses, it's not that there's no hope, but just that what you're hoping for can potentially change over time. And at the end, even when no treatments potentially, make sense as far as chemotherapy, it's again, hope to be able to spend time with your family, hope to be able to, feel well enough, not be in pain, to be able to do the things that have value for you. So, what you're hoping for, of course, changes over time. At the outset, you're hoping to live a long, 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 long time. But even if you don't make that, hit that mark necessarily, and unfortunately that's the case with glioblastoma more often than not, then, I still think that it's important to be able to find the things that you can still hope for. And I think diet and nutrition very much fall into that realm of things that people can control. It's within their sphere of control. It is something that is an outlet for basically what they are able to control, and they can immediately see basically how it affects them and how they feel. And so in that sense, I think it's, it all kind of comes together, of course, in just trying to, not just treat patients as, this is your tumor, but basically treat patients as whole people.
Yeah, absolutely. I think that whole person approach is critical, and just providing that, hope to the patient as well, and making them feel involved in the process. And what is it like for you as a physician to, obviously exploring this potential therapy as an additional tool in the toolbox, that even though we don't know how things are going to shake out just yet as it pertains to glioblastoma, but knowing there's the potential for this additional, potentially, non-toxic therapy that may be useful. What is it like for you to know that you may, hopefully in years down the line, it may prove to be something that could be an additional tool for you?
Yeah, I would say, I guess the same thing applies. It's hope for me too. And it's been really since this whole experience has started, which again, it wasn't because of some big idea that I had. It was just other people kind of saying, hey, you should look at this, you should look at this, until finally we looked at it. I am very optimistic about the future. I know that, again, you can look at where we've come in the last 20, 50 years with glioblastoma, and it hasn't been so great, but I'm very optimistic about the future. And it's for a combination of things. Of course, I have more of an understanding of metabolism and physiology than we ever have. There's so much that we've learned in a short period of time, and specifically how metabolism, is at work in cancer cells. The tools that we have to analyze the effects of what we've done have improved dramatically too. So again, we don't have to necessarily do a one-size-fits-all approach where it's one treatment that's going to cure everybody with the disease. But if we can even study and understand, okay, what is it about this treatment that certain people respond to, but maybe others don't, and then be able to understand that and really tailor treatments according to the patient, to the physiology of their particular tumor. That's really, really exciting to think about too. So there's just so much that we don't know still at this point in time. I mean, a ketogenic diet, there's so many different types of ketogenic diets. You can compose it in so many different ways. Is there one that ultimately is better? There's so many things you can combine a ketogenic diet with. Yes. that might potentially make sense. There's so many different things to potentially study with all of this. So, it's exciting to kind of be in this area there's so much interest, not just from, the stodgy physicians, but also from just the community of patients and people who are, interested in the well-being of patients. So it's been great to be part of that community with, of course, the Metabolic Health Summit playing a big role in all of that as well. Like, it's really, I think, we're kind of riding a wave that's cresting, and it's really exciting to be part of that.
Yeah, absolutely. We couldn't be more thrilled to be somewhat of a platform in the process and bringing all these incredible minds like yourself together so we can continue to further this research and collaborate in ways that maybe we didn't think about before. I think that's really where the magic happens, is coming together and kind of putting those minds in the same room. And yeah, we couldn't be more thankful for the work that you guys are doing at Cedars-Sinai. It's so critically important in order to further this one way or another, right? And understanding how it might apply to something like brain cancer. What is the future? I mean, what's next for you and where you want to go with this kind of research, with nutrition therapy specifically, with something like brain cancer? What's next for you guys?
So I think one important thing to do, which of course we've touched on, is we need to grow the science. We need to understand more about what the actual effects of a ketogenic diet are for a person and also on a tumor specifically. And so we need to be able to study that very rigorously. We need to be able to do these well-designed, larger trials that are specifically geared towards figuring out the effectiveness of a ketogenic diet. Those sorts of things are important on the scientific end. We need to figure out what are the right treatments to potentially combine with the ketogenic diet or other dietary intervention, for that matter. There's so many, interesting candidates that are out there. Maybe it's a combination of a few different things, and maybe it varies patient to patient what makes sense as the best combination. So being able to think scientifically about all of that is very important. The other side of things, I think, that's also important is we do need to move a bit further away. We've moved to some degree, but we need to expand upon our idea of what cancer care is within the US healthcare system. Of course, everyone's familiar with the initial parts of a glioblastoma diagnosis. There's somebody has a symptom, they come into the hospital, they get a scan, they have a surgery, and we talk to them about chemotherapy and radiation therapy. There oftentimes is not much for anything beyond that. There's not much for, talking about well-being. How are you coping with all of this? There's not too much talk about, okay, it's really important for you to be active, to not just, sit in bed all day, to not be, just on your phone all the time, reading about, horrible things that go on.
Scrolling, yes.
Exactly. We don't talk to patients about that. We don't certainly talk to them enough about diet and nutrition. And again, of course, we've made a concerted effort at Cedars to try to do a better job of that for all patients. But there's a lot that we do that kind of falls under this umbrella of supportive care. It's not just supportive care. It's treating people as people. It's really paying attention to what it means to be, a person and have well-being, in your life, and to have a quality of life that's worth preserving. And I think there's a lot that we need to do to be able to include that, not just sort of as something on the side, which is, I think, kind of the way that it's done in the United States healthcare system, but really kind of up front and center, along with chemotherapy, radiation therapy, and these other things. I do think that once we are able to take that approach, that we will see improvements in outcomes for patients across the board. Yeah. And again, it may not be like any one intervention by itself. It might just be kind of the holistic approach that ends up being beneficial. But hey, as long as patients are doing better and feeling better, ultimately that's the most important thing.
Yeah, absolutely. It's is this something that at Cedars-Sinai, it's challenging to be able to offer that whole person care with what you guys are currently already sort of tackling here with the cancer itself and whatnot. These are sort of resources that are challenging to kind of bring together, but so necessary, as you said, to, treat the whole person. And, our psychological well-being is so important as what's going on, physically. So how do you see that kind of happening, that kind of bringing in all of those components, in the future? What's the road to get there? Can you answer all these hard questions for us?
Yes. Can I solve the issues in the United States healthcare system as a complete non-expert in health policy? I wish. Again, not to get too deep in the weeds as far as health policy goes, but pretty much how it goes is, yeah, the type of care that you get is basically what's reimbursed by insurance, and chemotherapy is reimbursed by insurance, surgery, radiation. But when it comes to, nutritional counseling, physical therapy, talking to people about mood and anxiety, those sorts of things aren't necessarily so well reimbursed by insurance. So they tend to kind of fall by the wayside a little bit. I mean, certainly this is not like news to anyone. So I do think that there is a lot of movement in healthcare to try to fix some of these issues, and to make it so that that there are more resources available, basically for more holistic, person-centered care. There's a lot of good research that's going into it too. I mean, all the professional societies are definitely making more of an emphasis on it as well. So I do think that, we are heading in the right direction. At Cedars, I would say we're fortunate that, we have basically leadership that's really identified this as a priority. We have a lot of great people who will basically work in this area to provide care to patients, but also to do research in it as well. And I'm fortunate to work with, a lot of these folks. And so it's a great environment just as far as, my own institution. But yeah, still ways to go. And, I think things like Metabolic Health Summit that, just help to raise awareness and interest and motivation and bring everybody together. That is, I mean, just to see how something like that has grown year over year over year. I think that's really exciting to see. And again, the downstream effects in terms of what it means to patients and how it ultimately affects patient care. That's it all starts somewhere. So.
It does. And thank you for your kind words on MHS. We honestly, it is what it is because we have people such as yourself coming out to speak on the important research, which is also a big important piece of the puzzle, I think, in getting closer to more inclusive, whole person kind of care that, this science is going to provide us with the answers of which direction we need to go from here. So thank you for the work that you do as well. And Cedars-Sinai is definitely on the cutting edge and progressive in that sense of leading the charge when it comes to exploring certain avenues like this. So it's really exciting to see the direction and just the efforts your team has really put into this and where you guys are headed with it. What are you thinking in terms of, I'm sure there's many areas you could discuss at Metabolic Health Summit 2022, but what are you thinking in terms of what you're going to talk about at our upcoming conference?
Yeah, well, it's been an exciting evolution for me because I would say I think the first time that I gave a talk at the conference, it was, well, this is what we would like to do. And then the next time I gave a talk at the conference, it was, this is why it's difficult to do the things that we would like to do.
Which is super helpful insight. Yes.
Yeah. I mean, I think it's important. I do think that, we got to go into it eyes wide open for sure. Yep. But this time around, we can talk about what we've done. We can talk about what the results that we've seen, which again are really quite neat to see, really encouraging. So I'm happy to kind of be at that side of things. Again, there's still so much to do, as you know. So I think being forward looking is still ultimately, always going to be the case. But yeah, excited to have results of this trial that, at the outset was just kind of, it was just in our heads, and now we've done it. And it took the work of a whole lot of people. It took the buy-in and commitment from a lot of patients and their families who came from, I mean, we were amazed. People from all over the area and even out of state actually came to participate in the trial. So it took a lot to get it all done. And so it's nice to be able to talk about it.
Yeah, I'm really looking forward to being able to take a deep dive into that. I mean, I've been lucky enough to hear some of the results there and, experiences with patients and things like that. I think it's going to be really motivating, for patients in the audience, but also for other clinicians in the audience that are interested. I think there's still a lot of work to be done in helping other physicians maybe feel comfortable enough to explore this for themselves within their own research. So I'm really excited for you to be able to share results. I mean, I can't believe from when we first started all talking about this and learning about your interest to now where you are. It's really inspiring. And I can't thank you enough for the important work that you do and the challenging job that you have, Dr. Hu. It's just much respect to what you do and where you're headed.
Well, thank you so much for that. Again, it's basically just showing up every day and trying to do right by your patients, and yeah, we'll keep going in the right direction step by step.
Absolutely. Well, thank you so much for chatting with me today, for everybody to hear a little bit more about what you do. If you're watching and you want to come out and watch Dr. Hu speak and learn a little bit more about his research, come on over to metabolichealthsummit.com, get your tickets. Definitely snag one because you won't want to miss Dr. Hu's presentation. And thank you so much for joining me today. It's been a pleasure as always chatting with you and excited for what's to come.
Thank you. Really appreciate the opportunity.